Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, everybody. Welcome back. Today I have the pleasure of speaking with Mr. Jeffrey Charles Hardy. Hi, Jeff. How are you doing
Hello.
today?
Hello. And Idongesit?
Yes.
Is that right? Or just right?
Idongesit, yes. How are you doing today?
Couldn't be better. And you?
Love it. Love it. Can you tell the listeners a little bit about yourself, who you are, your organization, and yeah?
Well, let's see. I'm Jeffrey Charles Hardy, and the reason why I'm doing podcasts is because we got kicked out of Myanmar. We built a incredibly wonderful community development and health center in the most deep rural area of Myanmar. Yeah, there's nowhere in Africa that is as deep rural where we built this community development and health center. And it was so successful that it's still going today, even though the military coup came over and told the government they got to get out of there, and we had to get out of there. And we were ready to build 250 more of these facilities in Myanmar and really provide care for the peace of the people in the country. Care for Peace is the name of our organization. It's also the name of an anthem song that I wrote for the groundbreaking of our facility and for the children actually to sing at the groundbreaking. And then when I got booted out of the country because the military came in, and that was it for Aung San Suu Kyi and all her people and all the ministers that we'd been working, who are either now still in jail or with Aung San Suu Kyi, she's in house arrest. But that's only recently. She was in jail until it got too hot and they decided to move her. But I had nothing else to do but write a book, which guess what? It's called To Care for Peace. Let's see. I don't know if you're video, but that's the book right there.
To Care for Peace.
It's To Care for Peace. It is a global mandate to secure the second human evolution and perpetuity. Now, I challenge anybody to remember that. Well, you have to buy the book so that you can, no, don't listen to it. Anyway, so that's what I did. I wrote a book, and that's where I'm at right now. And I decided that, well, what I'll do is I'll start talking to people on podcasts so that I can perfect my pitch, because I'm used to standing on stage and talking to people about specifically healthcare, how to build a hospital, how to design a hospital, how to manage a hospital. I did a whole thing on nursing-focused care, and so I was real popular with nurses all over the world because of that.
Right.
And No Hidden Patient. I even had a website at one point called nohiddenpatient.com. No longer there, but my articles are still there. But I'm used to being on the stage, so I figured that the best thing I could do is to practice my new move towards this whole idea that if we have the care that we have in our hearts and that we use in our hands, then that care will provide our own feeling of peace as well as peace for other people and for the planet. And so I've got delusions of adequacy and delusions of grandeur. I got every kind of delusion there is, because I believe that the tools that I was using for planning health care for 50 years, both in the United States for some of the biggest hospital corporations in the world, and Kaiser Foundation International, Kaiser Foundation Hospitals, Catholic Healthcare West, and then, of course, Columbia HCA. I mean, I worked for all these big companies outside the country before I started my own nonprofit organization to be able to pass this whole process of planning healthcare facilities elsewhere in the world where they really needed it. So I went from getting paid a lot of money to getting nothing. I never got a penny for my work in Nigeria or for Vietnam or for Myanmar. It's just, I decided to give it all away. But I want to be able to talk and to speak, to stand on a stage again and talk with college kids and high school kids. And I want to speak to the next generation that really has a reason to learn how to care. And they need to learn how to plan the second human evolution. Now, would you like to ask me a question?
Yes, no, I love listening to you because it's fascinating that you have this illustrious history of working with this well-known healthcare organizations, and you, in a sense, gave that up to pursue humanitarian endeavors. What was the turning point for you? What did that for you? What made you say, you know what, maybe I need to look at the human side of things and help out where help is needed?
I have to go back to the origin of that question because I could easily say, well, I sold my company in the late 90s to a Fortune 500 company and I had enough money, to be able to start giving back, giving ahead, pay it forward. But that's really not the origin. The origin occurred way back when I was a kid and my parents took me to Mexico from this real rich county that I live in. And it just completely changed my perception of the world. I mean, I thought the world was just white people, you know. I didn't realize that there were other colored people, and I wasn't even born in a prejudice situation because they were all white. Everybody was white. Nobody was prejudiced towards anybody
Right.
because there wasn't anybody to be prejudiced to. And here I am in Mexico where there's a whole bunch of different colored people. They were, but they were poor. They were just living in the poverty. It just hit me. So when I come back to California at the age of 10, and I'm sitting there in my bedroom thinking, my God, I can't complain about anything. I don't, I've got walls. I don't have cardboard and, corrugated slats over my head. And so that just created this angst that I had until I was in the United States Coast Guard Reserves as a hospital corpsman trainee, taking care of the Mekong Delta seamen who were coming back and they needed care in our infirmary. And I realized that acting as a nurse, we were called hospital corpsmen,
Right.
these guys were so grateful. And I love this feeling of caring that I had while I was physically caring for these guys. And I love the fact that my caring gave them a peace and I had a peace. And this was 50 years ago. And I was just absolutely amazed. I realized the peace is a feeling. It's not this place between wars. It's not the space after people kill each other. It's not the space between wars, which is, oh, well, we had peace for a while, but then another war started. And it's not sitting up on a mountain with your legs crossed and your arms, whatever they are, and your eyes closed, while the people down in the valley are suffering. That's not peace either. As I say, it's like I got it. And then I said, wow, I've got this incredible feeling. And I started working with nurses after I left the Coast Guard, and I found out something. It wasn't my idea. Every nurse that I met knew what it meant to care for peace. I was like, oh, this is nothing new at all. So, I mean, care for peace is what inspired me. So that's the answer to your question.
Right.
That's
I love it. I love it. As a nurse, I can relate. I know what you're talking about. Nursing is, a thankless job. We care. And you can tell the nurses that are passionate about what they do and the nurses that are not. And often, passionate nurses always find a way to care, whether it's at the bedside, in case management, community health, wherever. Nurses always find a way to make a difference in the community. So I'm very happy that you have experience working with the best career ever.
Yes, that's right. That's right. The only thing I would add to what you're saying, because you
Right.
said that it's thankless, and what I say, it's just like the word peace. peace comes from within. You get peace. That's it. But thanks, especially when you're a nurse or a hospital corpsman in my case, and helping people all over the world, peace comes from within. And thanks comes from within. You don't have to be thanked by your patient who's screaming in pain and calling you all sorts of names because you just saved that patient's life.
Absolutely.
That's thanks.
Yes. It doesn't hurt to be appreciated by the organization either. So
Well, that's why we put flowers on your desk and we give you lots of candies. I mean, the See's company, that company, and Godiva, that other candy company, they make their money on nurses. I know it. Because all the gratitude that happens all the time is always right there on the nursing counters in every hospital I've ever been to all over the world.
For where it is happening, kudos to that facility. It doesn't happen for everybody, but
No, that's true.
Let's move on from that conversation. So, talking about Nigeria and other African countries where you have established these community-based healthcare programs.
I have consulted.
You've consulted in Nigeria, but not.
Yeah,
okay.
But I have not personally been involved with building. For instance, when I was in, I helped the Matababu Hospital process, design and facilitate their hospital, but I did not actually design it. And I gave them a fetal heart monitor. I mean, I did all sorts of stuff for them. Right. For Nigeria, I helped them design a hospital, but it was when I was talking with the governor of Rivers State, the Honorable Amici Rotimi, wonderful, highly educated man, about the problems in Nigeria. And here I was planning on helping them design a maternal and child health hospital right in the middle of Port Harcourt. Well, if you go to Port Harcourt, you will be in a traffic jam everywhere. It doesn't matter where. And I'm here in the traffic jam going to the governor's house. Hi, Governor, how you doing? I'll be there in like 2 hours. It's just unbelievable. I was talking with him about, we shouldn't be building a hospital. We should be building small little facilities. And that's where the idea of small mini health centers originated. Now, yes, I've been in hospitals in the United States, and I helped with small clinics. In Bahrain and the Persian Gulf, I helped them design a very small clinic, which was so successful in Bahrain. And I just said, that's what we need to do. We need to build smaller places that are on the periphery of Port Harcourt. And these would be the places where, yes, I know you've got problems with your ethnic and tribal animosities that are just constantly hurting the country everywhere. It's not just Boko Haram, it's all over in many different forms. Okay, Boko Haram itself is not all over. But, and I said, we can maybe have all these different nationalities and tribal and ethnic people working together in the healthcare facility, and let's maybe show the neighboring areas around these clinics how to care for peace by putting people together. And that's where I started using the words care for peace. And that was way back in 2008. That was in 2008. So, and that was just an idea. And I left that with the governor, and they still they designed and built the hospital, I guess. I didn't go back because I do a lot of pre-planning with people. Okay. My job is to get the people together and to get them moving in the right direction. And ideally, it's way before the architects come. And then usually I'm there a little bit after the architects get there, but I don't have to be there for the rest of the time and for the building. I don't, I need to move on, help in another pre-planning process. I'm a facilitator. So the facilitator starts the planning process. And guess what? That's what I'm trying to do with this book. I'm saying, look, you can use the tools that I have developed for healthcare, at least to inspire the move to plan the second human evolution.
Right. So it's great for the planning. Okay. The other part is the buy-in. Often when we talk about healthcare, right, we talk about healthcare, we talk about the Western world's advancement in healthcare, we talk about the implementation of different practices in healthcare, right? Planning and building a structure or hospital or a pathway to a better health provision, or like you said, the second human revolution is one thing, but having the partnership and the buy-in from other healthcare sponsors, for lack of a better word, right? Other organizations that do humanitarian work. When the building is erected, when the structures are done, when we have the organization, okay, all in the planning phases. Okay, we need, 5 doctors, we need 10 nurses, 2 nurses per doctor, all of those things. Where is the investment on, training those nurses? Do you have partners that are willing to also collaborate with the government who are willing to have you on, right? To build this plan, past the planning phase. We plan and then we implement. Okay, you've worked with nurses, you know that we have the nursing process, right? We first assess the need, we diagnose or analyze what the need is, we plan it, and then we implement it. After we implement, we evaluate it. So do you have partners, or do you have organization or well-meaning folks like you who are willing to handhold during this process? Because again, when something
Right.
is new to a government or a people, they need some support and some guidance in implementing it in a way that
Yeah.
brings benefit to the people.
Right. And nothing that I'm doing is new.
Mm,
And the partners that you're talking about are already there. An example of that was when we were in Myanmar. We ended up partnering with a man who, when we were being considered by the government to help out this process, the man was a medical doctor. He was in the union president's office, and he read the letter from me that said, here's what I'd like to do. He came to California and visited us and took a look at our healthcare system. I showed him hospitals and clinics. He came to my house, and my wife made a wonderful dinner for us. And then he says, well, you know what? I think I've been working with the government, and I've been a medical doctor for a long time. I think I'm going to start a nonprofit organization too in Myanmar. At the same time, we decided to start the Care for Peace Foundation here in California. It's like, so all of a sudden we had a partner in Myanmar of medical doctors who ended up helping us with the whole process. And then we ended up linking up with a bunch of people who were part of the Rakhine state, which is it's like California of Myanmar. If you looked
right.
at a map of Myanmar and all the 14 states of Myanmar, it's like it's right on the west side, just like California. Mangrove swamps all up the coast and down that unbelievably beautiful, beautiful country and state where we built our clinic. And so all of a sudden we had a whole bunch of people from the inside that state, and they had an association, so they helped join. And then we worked with nurses and doctors during this whole process, and there were so many people ready to help. It's not funny. And so but the process is the solution. Oh, by the way, right on the bottom of the front cover, it says the process is the solution. It's very important. The process of moving forward is to stand back.
Mm,
You got to stand back and look at what's available, where they're at, what do they need. My first question is, how can I help and how high? That's my second question, first thing and second question, because they know what they need.
right.
And so all of a sudden the doctors started coming out of the woodwork and saying, oh, you know what, we don't need a clinic like what you're talking about or a hospital, forget that. Why don't you give us a van that we can drive, that has knobby tires on it and sits up a little high so that you can go through the rough terrain to go to the villages and just do health screening and maybe, give a few medicines. So that's what we did. Our first job in Myanmar wasn't to build anything. We gave them a clinic. And then they said, well, yeah, you're using that computer and that projector thing. We need one of those. So guess what? We gave them a computer and we gave them a screen, so they could project. Oh, and then they needed a generator so that they could generate the energy for the screen. So what really happens, to answer your question, is it occurs. And, there's an expression, God will provide. Well, God is us, and we will provide, especially in the healthcare world. You've got so many people who are highly motivated by their spiritual nature. It's that nature that holds the peace, the nature that holds the thanks. It's the nature that holds the future of humanity, because that's where care for peace is really about the future of humanity. And so your question about, how do you get all these people and everything? I've never had any problem.
Great.
All over the world. They're
Great.
there. Everybody's there.
I love it. I love it. And I specifically love the idea of innovativeness when it comes to providing care, where we're not just stuck with, okay, it's only a physical structure that you can go to get care. The premise of having a mobile van that can go from community to community, assessing the need, providing vaccination, caring, or follow up is something that even in the United States, this is something that is heavily being implemented. Community-based care, right? And using community-based advocates has been shown to increase patients' interaction with the healthcare, community and their doctors, the ability to follow treatment recommendation and be compliant, right? So meeting a patient where they are, meeting a person where they are, also considering that traveling to this particular location might be one of those barriers to them actually seeking and receiving care. So I love the innovative, thinking behind that. So my next question to you is, what do you need to see from, say, the government of a state or a country for your organization to step in and, implement useful healthcare planning and intervention? So what is it that you require? I know safety is big on the list, right? Safety is a huge thing.
Right.
What is it that you're looking for? Because you mentioned this happened in River State in 2008. That was the last, interaction you had. And since then, there's been many, many, many cycles of elections. So I know the governor is no longer the same governor today.
Right.
But I can see a lot of usefulness with the conversation that we're having, even in my own state. So what is it that you need? So if there's something that needs to be facilitated, I'll be honored to work on that. What is it that you specifically need from a government or country or community to be able to apply your planning and humanitarian endeavors?
Well, I think that the reason why I like your question is because, you're saying, where do you start? And so I got to start at the top, because eventually I need the top to be helping me at the very place where the help is needed.
Right.
And that's in the rural areas. And I need to be able to find a place where I can put someplace, because it takes about 6 years. And the reason why it takes 6 years is, hey, we already have the tools. We already have the process documented. We've got more paper on step by step by step. And I'm not going to give the pieces of paper to people, because the whole process of educating and the process of learning, process is a solution, absolutely has to occur, and it has to start at the top. So what that means is we had buy-in, not from Aung San Suu Kyi, actually. It was from the president. She ended up coming in after we first started. And then, of course, she bought in, and her number one counselor ended up being a member on our board. And we had a board both here in America as well as we had a board there. And you have to have a solid top And you have to have people who don't just buy in, but are willing to go the distance. I mean, you got to have it. And we had the Minister of Health just right there with us. And a funny story about that is that when I met with the Minister of Health the first time, and explained to him what we wanted to do, but also explained to him how we wanted to do it, we would want to work with the government. We would want to know how the government was working now so that we could dovetail into what they're doing. And if there's some way we can help them, again, how can I help and how high? Right to the top people, not just to the people down in the village who say we want a van.
Right.
The people at the top government is going to say, well, you know what we need? We need you not leave and just come back every year when you want to redo your memorandum of understanding, which is only a 1-year memorandum of understanding. They wanted to be part of the process.
Mm-hmm.
And he said that the Minister of Health said to me that he said, what most of them do is they come and they sit in that wonderful seat that you're sitting in. I mean, it was a luxurious place, office air conditioned and everything else with couches. You wouldn't believe how gorgeous it is. I mean, it looks like, I don't know, Idi Amin's waiting room. Help. Anyway, he said, this is what we want.
Right.
The people who come in and sit in your chair, they leave and they come back every year and they leave us holding the bag.
Right.
We want to be part of what you're doing. And so I said, you got it. And that's exactly why I am here, because we're not going to do anything down there unless you help us. So I turned it around and he says, well, you know what? I got to tell you something. And this is the best part of the story. He said, when I was a medical student going to the med school right here in Yangon, I was sent to Hawaii for a 1-year program to go to the University of Hawaii and learn a bunch of things that we could learn for our healthcare, mostly in data management. And it just so happened that my father was an associate clinical professor of maternal and child health at the University of Hawaii, who for 17 years taught 10 people, medical doctors from Myanmar. Every year he got 10 new students. And he said, I was one of those students. I could not believe it.
Wow.
Here I am. And I just loved it. I said, you waited until now to tell me. He said, yes, I did. I waited until now to tell you. So we did everything right in that wonderful country. And I just, because by the way, I've made a lot of mistakes outside the country and inside the United States. I've made more mistakes than anybody in the world. I challenge anybody to a mistake duel anytime, because I'm not going to make the same mistakes in Myanmar that I've made in other places, and I'd even include Nigeria there, because, had I known how difficult it would be to do anything in Nigeria, I still would have gone there, because it was a wonderful experience, but I would not have thought that I could possibly build a hospital there, when what they really needed were care for peace clinics, like what we ended up finally being able to build in Myanmar.
So it depends. Nigeria is not a small country. So when we're talking about Nigeria, it's a huge country, and there's a lot involved, right? And also a lot of decisions are also made on the state level. The same way organizations go on medical mission, nurses, doctors, even the media. We talk about the biggest media companies, and Sony, all of them. They go there to establish different things. It all depends on who you talk to, and also your intentions.
Right.
Because the one thing that I can say, I'm very proud of the new age leaders in Nigeria, and a lot of the current leaders. Not all of them. A lot of the current leaders, I'll speak for my side of the country, is that the people's needs are being placed forefront. I'm from a state called Akwa Ibom State. I absolutely love my governor. And he makes sure a lot of needs are met. that benefits the people. So there's a lot of vetting, there's a lot of listening, a very intelligent man that wants to understand that your involvement is not for just selfish gain, but also benefits the people. Like business is business. You may gain something from it, whether it's notoriety, whether it's financial, whatever it is that your intention is. But first and foremost, how does this benefit my people, right? So when we're comparing countries, size does matter, right? Size matters. And involvement also matters. And also leadership also matters. So if you have the purest intention and you intend to provide services that actually benefit the people, a good leader will not turn you down. So that's why I asked you that question. What is it that you require? The buy-in is one thing, safety is another, but also collaborating and working together with the people is something that will help you be successful.
What we require, I mean, the first one was most important, so I did spend a lot of time talking about the buy-in that you're talking about. But then more than buy-in is the participation at the top level. Okay, more than that, going down further is we need to have money dedicated to the projects. And that means we have to sit and look at their budget, which has to include everything. I mean, you have to look at the price. And we did that. And the government was going gulp, but we showed them what it would cost. Well, we came up, now this is going to be interesting. We came up with a total of $200,000 over a 6-year period. And that included my airplane flights and my hotels and my boat rides, ship rides, because we had to take a boat for 3.5 hours to a place where we ended up hiking all the way to the village. I mean, that had to include our funds that we needed to be able to just get places and live there. Not one penny goes to us because that's part of a foundation. I mean, we're a different foundation. We are not a funding foundation. We are an operations foundation. It's very important. People do not hire us because we're Bill Gates and we can give money and fish nets. No. What we do is we come up with a budget together and say, okay, here's what we're going to need. Here's what we'll get from the foundation. Because we got like 3,000 people who are in our list, but most of them are Myanmar, but we've got to start building that list again if it's for another country or another state. But and then probably the last thing I've got to mention is that you got to have a vision for what you really want to be. And I started out before a memorandum of understanding, I said, we need to plan this to be a prototype facility that will be in 250 other townships within 7 years. Because I wanted 6 years to build the thing. Actually, I wanted only 3 years, but we had the van. We had a whole bunch of other stuff that we were giving them before we actually started building the clinic. But it was really a 3-year process once we got started. But you've got to have that vision. And the government was saying, 250. Yeah, I mean, we've got 53 million people in our Myanmar, Burma country. And out of 53 million people, 50 million live in the rural areas. So, let's build 250 of them. And they were saying, at least. And I was saying, you win. So, you got to have a vision. Because once you got that, you've got everything else. Everything else will just fall into place. I promise it will fall into place. Once you get started on something like this, all sorts of wonderful people just come out of the woodwork and say, oh, can we help? We're an association, but nobody's ever paid any attention to us. That's what happened in Myanmar. The Rakhine Association said, well, we're just sitting here trying to help people. And what can we do? So we ended up having meetings with the Arakan Association. And when we presented, unbelievable. We were given a big presentation party. I'm talking about unbelievable ceremonies and everything, and I had to speak at it. And this is all on videos too. I'll share them with any government who wants to see what buy-in looks like.
I'm
We
sure,
had
all of those things will help with buying in. And the thing about fishnets, most African countries do not need fishnet donation. They need, tangible investment, because truth be told, we
right,
do furnish the rest of the world, right? From our natural resources. So from
right,
the gains you have from those natural resources, if you have organizations that are willing to do the basic for humanity, which is good healthcare. In America, we have the People 2030, right? Equitable care for all. This is it, right?
right.
Equitable care, not just for people in the Western world, but also in Africa. So keep the fishnets for good. Invest real money and equipment to help people meet their needs. That would be great. So I and just to you touch on the tribal stuff, the tribalism or a conflict and all of those things. Again, going back to leadership, often people get up in arms when one tribe is favored over others. So when we're talking about
All
buy-in and
right.
involvement, so if anything needs to be implemented, I think that in the planning phase, which is primarily what you focus on, it is important to involve all the tribes involved equally. Right.
Oh,
So everybody,
absolutely.
everybody should know that this is something that benefits them in their
Yes.
community, as opposed to having somebody travel across community, across villages, across town to
Right.
get to another
Right.
town to get care, or help. So these are
Thank
the
you.
kinds of things that reduce conflict. So
Thank you. Excellent. I really appreciate that. That absolutely.
so
Well
yeah,
done.
we can reduce the conflict greatly by involving everybody and working with leaders that treat all the tribes involved, because in Nigeria alone we speak over 250 languages, and with those
Yeah.
250 languages are
Right.
different cultures within those languages. So of
Oh,
those, I speak three fluently. I understand five, right? So that is from just one person. And that's a
wow.
drop in the bucket compared to 250 plus.
Yeah. Yeah.
So, again, all countries are different sizes and also leadership. And if anybody is listening and you absolutely love this conversation and you want to get involved, either with me directly or with Jeffrey Charles Hardy, not Jeff Hardy, Jeffrey Charles Hardy, and his organization, please, we'll leave the information on the footnote of this podcast. Jeffrey also has a book. We will leave a link to his book. Is your book on Amazon, Jeffrey, by any chance?
Amazon. Yeah.
Oh, okay.
Yeah.
So we'll leave a link to his book for whoever is interested in buying and reading it. It sounds like a great book with a lot of nuggets. I'll also get a copy so I can also educate myself. But when it comes to investing in equitable healthcare for all, I think that is something as humans we owe each other, and also we owe one another in supporting each other's effort, right, to have this done. So what would you have to say to that, Jeffrey? Do you have any last words for us? Last pieces of nuggets?
I just think that you've touched on something that none of our other of my other podcasts, and it's probably because from the very get go I thought about the fact that you are connected to a state in Africa that could possibly take the ball that was dropped in Myanmar. And I would be absolutely delighted to continue that discussion if there's somebody at the very top who might be inspired by that. And I would say that's my last comment is really that we explored the opportunity with two Central American countries, and we met up with way too many impediments.
Mm.
that would get in the way of our going there and feeling safe and being able to find a place to be able to build that community development and health center. Because, and by the way, those two things absolutely have to go together, because I won't just build a building and they will come. And I also won't build a building that requires us to continually fund. I require 100% community involvement and government, however that is, to be in charge of funding any continuous process. Because we have seen failures, and this is not a failure of mine. This is a failure of another organization that we actually partner with in exploration, that was in Ethiopia, and they built a beautiful place and they put money into it and helped and everything, but then the money ran out and that was it. So they've got a building and nothing's happening. But, well, I shouldn't say nothing. Some of the bare minimum stuff is happening, but they don't have any money from America, from their American donors anymore. I won't do that. No, it has to start very right in the beginning, that this is yours to have, to hold, to love, and to cherish. And, we've performed the ceremony, but you've got to make this marriage work. And so they've got that in their mind when they're doing it. And so it's great, because they don't say, I want a big, huge, gigantic clinic. They say, well, we're going to have a clinic that we can manage. So our clinic doesn't have a whole bunch of rooms in it. It does have a birthing suite in it. We have motorcycles outside the clinic in Myanmar that are still being used by the midwives so that they can actually drive their rough and tough motorcycles out to the outlying areas to help deliver babies. I mean, but we didn't pay for them, not one penny. So my inspiration today was you, and what you're saying to, that you can maybe for your state. So let's talk.
Yeah. I look forward to that conversation, because it's not uncommon. I am very proud of where I'm from. We have established teaching hospitals. We have established medical training facilities. We have established private doctors, right? So
what is the state?
Akwa Ibom State. Akwa Ibom. Yes.
Okay.
So we have that in place. So is not we're not building anything from scratch. If anything, we are re-energizing and seeing how we can already use what we have in place to benefit our people. Yes.
That's awesome.
So I entertain these discussions because I'm very passionate about helping. I'm very passionate about educating. And I'm also very passionate about helping. I am a nurse through and through. So if there's anything that I can do to benefit my people as a whole, whether it be Akwa Ibomites, Calabar, River State, Cross River State, it doesn't matter, Nigeria, Africa as a whole, if I can, be a catalyst to help strengthen the relationship within my community. Somebody made a statement yesterday that I've heard it before, and it settled a different way yesterday. It's like, there's no Calvary coming to save us. We are the Calvary. Yeah. So I am the Calvary for my people. I'm not, like you said, the American donors said, I'm not giving any more money. So when that stops, then what? Right?
Yeah.
So if we're not supporting one another, if we're not reinvesting in our communities, for the ones in the diaspora, the ones back home that are well-to-do, if we're not investing in our community and our people, there's nobody that will do it, right? So we are wealthy, rich people in spirit and otherwise, and resources. So I welcome conversations like this. And also, with your buy-in videos and everything, I think that will come in handy for anybody who wants to listen or, learn about your processes. So thank you so much, Jeffrey Charles Hardy, for being here. For everybody who's listening, thank you for listening. Please engage, comments, let us know what you think about this conversation. If you have anything to offer in addition, please, we welcome it. Jeffrey, I'm going to have Jeffrey come back on, okay, as this conversation continue to develop, as we continue to stay in contact with each other and talk more, I would like for this to actually be a thing. Yes,
Yeah.
this will be a dream realized. So thank you so much for being here.
And thank you so much. Really appreciate it.
Thank you. All right. Bye, everybody.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.